Hi, my name is Danny and I'm going to talk about Baloxavir Marboxil for complicated influenza in adults and adolescents. Definition. Influenza is a viral infection that attacks your respiratory system, your nose, throat, and lungs. Influenza is commonly called the flu, but is not the same as stomach flu, viruses that cause diarrhea and vomiting.
The emerging resistance of influenza virus to antiviral agents is a growing challenge. The influenza polymerase complex is essential for the replication of influenza A and B viruses. Baloxavir Marboxil is a small molecule prodrug that selectively inhibits cap-dependent endonuclease, preventing polymerase function and influenza virus mRNA replication. Capstone 1 was a randomized double-blind placebo-controlled trial that evaluated the efficacy and safety of Baloxavir as compared with oseltamivir in a phase 3 trial. 1,436 patients between 12 and 64 years of age were enrolled if they had fever, one or more systemic symptoms, and one or more respiratory symptoms within 48 hours of onset. The patients were randomized to receive a single dose of Baloxavir or a standard 5-day course of oseltamivir or placebo. The primary efficacy endpoint, which was assessed in 1,064 patients with proven infection, was median time to the alleviation of acute influenza symptoms. Time to alleviation of symptoms was shorter with Baloxavir than with placebo, but similar with Baloxavir and oseltamivir.
Applications in medicine. Baloxavir Marboxil is a selective inhibitor of influenza cap-dependent endonuclease. It has shown therapeutic activity in preclinical models of influenza A and B virus infections, including strains resistant to current antiviral agents.
Breakthrough treatment of flu that we were talking about in our first half hour. It's a new pill that is meant to reduce the length of symptoms. It was just approved by the FDA, and Dr. Jen Ashton is here with that. And we remember how deadly this flu season was last year. So what's the news here?
We're just getting into this year's flu season. Obviously, we're going to be covering it and watching it very closely. But let me tell you about this new drug. It's called Xofluza. What is different about it, it is one oral single-dose regimen. So that's one pill. It's approved for people of age 12 and up, and it could potentially reduce not just the symptoms and the duration of symptoms by 1 day on average, but how contagious someone is. We don't know totally that data yet, but it looks promising.
Okay, so we know about the symptoms. What about the possible side effects?
Listen, you always have to balance risks versus benefits when you talk about any treatment, any medication, and like Tamiflu or that class of antivirals, there are side effects here. The common ones, headache, a little GI distress, upset stomach. There have been some reports of some mood disturbances and some psychiatric issues that will be being followed for sure. But again, we have to remember the flu-related deaths, over 80,000 in the U.S. last year.
80,000?
So, absolutely. So it is very big news that we have a new drug in our arsenal. This works differently than Tamiflu, so that's generating some excitement.
So when will it be available?
Pros and cons. Pros. Baloxavir was associated with significantly more rapid declines in infection viral load than placebo or oseltamivir. Cons. Adverse events were reported in 20.7% of Baloxavir recipients and 24.6% of placebo recipients and 24.8% of oseltamivir recipients.
So I think that the most important take-homes are threefold. One, that antiviral therapy, including Baloxavir, reduces the incidence of complications in patients with high risk for complications infected with influenza. Two, it shows that Baloxavir, a new class of drugs, is both safe and effective in the treatment of influenza. And then the third critical finding is that there's a much more rapid clearance of virus with those patients who are treated with Baloxavir. In addition, there was superiority of Baloxavir compared to oseltamivir with the treatment of influenza B. So most importantly, it will bring a therapy that only requires a single dose. So patients will be able to take a pill and be done taking the medications for the treatment of influenza. And after taking it, they'll be at reduced risk of complications, including those requiring antibiotics or other complications of influenza.
In Ecuador, the Ministry of Public Health, with the support of OMS, has developed the contingency plan for a possible influenza pandemic, as well as protocols in the area of epidemiological surveillance, health service, environmental health, laboratory, mental health, social community care, and among others.
For the first time in 20 years, there is a new flu drug on the market in the U.S., and it could make you feel better faster if you come down with the dreaded flu bug. ABC4's Saray Chin is here in the studio with us now to tell us more about it. Saray.
Don, the FDA just approved the new flu drug, Xofluza. The drug claims it can cut the time you're sick by half after getting the flu. Here's what doctors want you to know about it. Xofluza is for children 12 and older. The drug is already available in Japan, and now the FDA just approved it here. But it could be a few weeks before it arrives in pharmacies. Kristen Dascombe is the medical director for infection prevention and control for Intermountain Healthcare.
This may be a good option for patients who are more susceptible, patients like infants, immunocompromised patients, may help them reduce their risk of going on to having more severe episodes of the flu in the future.
Xofluza is a one-dose medication, and experts say it could alleviate symptoms faster than the widely used antiviral drug Tamiflu, which is also prescribed medication, taken twice a day for 5 days. Scientists and doctors have seen growing resistance to Tamiflu through the years, and so a new drug was needed. But with a new drug, there are unknowns.
Absolutely, it's a new drug. It's going to be more expensive and has to be evaluated by the insurance company.
Conclusion. Single-dose Baloxavir was without evidence safety concerns was superior to placebo in alleviating influenza symptoms and was superior to both oseltamivir and placebo in reducing the viral load 1 day after initiation of the steroid regimen in patients with uncomplicated influenza. Evidence for the development of the correction susceptibility to the Baloxavir after treatment was also observed.
Food and Drug Administration has approved Xofluza for new drug for flu on October 24, 2018. It was invented by Japanese company Shionogi. This new antiviral, generically known as Baloxavir Marboxil, is a single-dose treatment for flu. It is for use only in those aged 12 or more and should be taken only in the first 2 days after symptoms like fever, aches and sniffles appear. This pill will cost near about $150.
Thank you.